We are here to introduce strong reforms to fix a crippling problem for Michigan families, the skyrocketing cost of health care. People in Michigan are hurting. They've lost jobs and businesses. They've lost loved ones to COVID. Some of them have even fought COVID themselves. In every case, the existing problems with our rigged healthcare system are magnified. But as far too many people know in our state, those problems have always been there. It is well past time to fix this problem and make healthcare work for Michigan families. We're blessed to have some of the finest healthcare systems and healthcare providers in the nation, if not the world, right here in Michigan. But all too often, Michiganders can't access or afford the healthcare they need because of where they live, or what they do, or how much they earn. The Michigan House of Representatives is going to change that. Today, we're introducing legislation to ensure every Michigan family has access to quality, affordable health care. This is an opportunity to make real, profound change for the people of this state and to make Michigan the leader in the nation in health care reform. I'm grateful for the legislators on both sides of the aisle who are willing to tackle this big issue. I want to especially thank the Chair, Chair Colley, and Rep. Calley, who are providing strong leadership in getting this off the ground, and Rep. Hammoud, who has been working on this issue for many years as well. Together, we are offering legislation that does three things. It lowers the cost of prescription drugs, it increases access to new medications, and it makes the healthcare industry provide a higher standard of care to the people we represent. Through these 15 bills, and all the bills that will follow soon, we are addressing important issues that impact the people in our communities, from capping the copay on insulin to guaranteeing access to ongoing prescriptions. Those are the things that Michigan families need the representative to solve, and that's what we're going to do. And now I'd like to kick it over to the Chair, Representative Colley.
Thank you, Mr. Speaker. Thanks for being here. I think it's no secret to any one of us that times are tough right now here in Michigan and frankly all across the nation and the world. But access to quality health care is not something that Michigan families should have to be worrying about right now. And that's why this bipartisan plan is set to reduce prescription health care costs, to improve health care accessibility, and to increase the quality of care for people. This is more important than ever before because of the situation and times that we're in. With the ongoing pandemic, there are a lot of families across the state struggling right now to make ends meet. Saving money on health care costs could make a huge difference for working families and senior citizens that are living on fixed incomes, trying to make their bills be paid month after month. You know, listen, I've been hearing for years from people about the pain and the fear and the worry that they face when they aren't able to either pay for or access the health care that they need, especially when it comes to prescription medication. I think of people like Carol. Carol, someone that I knew before I was elected. I used to work directly with senior citizens and with some of the more vulnerable members of the community. And I'll never forget when Carol came to me and asked me a question, frankly, that was painful for me to hear, a question that no one should ever have to ask in our state, and a question that no one should ever have to answer, for that matter. She wanted to know which of the prescription medications that she was required to take to stay healthy she should skip that month. In other words, Carol could no longer afford to pay for the medications that she needed to stay healthy. She was forced to choose. Of course, I didn't know the exact answer to her question because I'm not a medical provider. But the question itself and all that it represented has remained with me ever since. And so I think of Carol today, and I think of all the other Carols that are out there across the state of Michigan that are struggling every single day to get the care they need. You know, people's lives can be transformed by getting the right medication at the right time. So this, which you're going to hear more of today, this is a big plan. There's no doubt about it. And it's a complex subject. But it's worth fighting the good fight, to learn, to listen, and to get it done right, because I've been hearing for years, and I bet many of you have too, that the way it is today just isn't working. Meaningful, bipartisan reform is possible. So people will no longer have to choose, and believe me, there's plenty that really do have to make these kind of choices between paying the mortgage or getting their medication. It's time for better health care that people can actually afford. So I'm looking forward to listening and having robust conversations about this plan in the weeks ahead and getting it done right. Thank you, and now it's my pleasure to introduce Representative Hammoud. Sorry, Rep. Hammoud.
Thank you so much to Chair Colley, and thank you to the Speaker for the opportunity to speak today. And I speak today not only as a state representative, but also as a public health professional, as an epidemiologist by training, as someone who grew up for the first 23 years of my life either uninsured or on Medicaid, who watched as my own parents struggled sitting at the dining room table wondering how can they afford private health insurance for their family. Well, I'm here to finally say we have a solution. A solution to the seniors who call asking how can they afford their prescription drugs. We have an answer today. A solution to those who are struggling with their insulin doses, whether they should buy their next dose of insulin or pay the bill that's coming in, or try to put food on the table. We have an answer. To the independent pharmacists, who are oftentimes the first point and a critical point of access to healthcare professionals in rural and underserved communities, who have been struggling to push back against the bullies in the healthcare industry, the PBMs. We have an answer, and we have support coming your way. This package of bills is actually taking leaps forward in making healthcare more accessible, more affordable, and improving the quality of care for all our residents. This transcends any political line or any partisan line. This is about putting our Michigan residents and our working families first. And to those families, I'm here to tell you that we're doing all we can. And I'm thankful for the Speaker's partnership, to Chair Colley and to Representative Kelly for all their work over the years on this effort. We're hopeful that we will get this thing across the finish line and try to provide meaningful change and significant change to your lives each and every single day, especially now in an ongoing healthcare pandemic that has uprooted the lives of millions of individuals across our country and across the globe. Thank you. And now I'll turn it over to Representative Kelly.
Thank you. That was fantastic. Good morning. The reality is, life-saving medications are worthless if people can't afford them. Prescription drug costs have skyrocketed. In 2017, 32% of Michiganders did not take their medicine as prescribed due to cost. Let's say our beloved aunt goes to the doctor, and it's determined she needs another prescription in order to protect her health. You might assume that the insurance company is the one who decides if and how that script gets filled. Actually, no. There's a middleman, a company designed to negotiate with drug manufacturers and create the list of approved medicines for each unique health plan. The result? This middleman has found a variety of ways to make money, shrouded in secrecy and silence. They have the ability to prioritize medications not by efficacy or affordability, but by how much profit in return they get for their recommendation. They choose profits over patients. They negotiate rebates with manufacturers, rebates that Michiganders, like our beloved aunt, never directly see. A recent Supreme Court ruling has clarified our state's ability to bring common sense reforms to these organizations, therefore reducing the cost of prescription drugs. In addition, our reforms will end the gag clauses and empower pharmacists to share cost-saving information with their customers. It increases transparency at all levels of healthcare and expands telehealth services to people who need them. Above all, this plan is a result of the consistent feedback that we receive from the people we serve. We are proud to bring this package of bills forward to improve affordability, accessibility, and quality of care. With us now is Representative Dare Rendon.
Thank you, Representative Calley, and thank you, Mr. Speaker, for allowing my legislation to be a part of this package. I stand before you today as an employer I have an office full of employees in my hometown, and as a two-time cancer survivor. Through the years, and I'm a senior citizen, so I have had the opportunity to avail myself of what our health system has to offer. I have been fortunate that I've had insurance to cover the services that I needed, but that wasn't always the case. And in the case of my employees, providing them with affordable health care and access to the health care that they need where they are has not always been easy. There are a lot of ways that we can improve access to health care and the affordability of it and still provide good services to families of all incomes. An example, I had an opportunity, or the misfortune, as you will, to be hospitalized in another country. I was there for a few days, I had several tests, and I had a lot of prescriptions. But when I walked out of that hospital, I had a complete bill that I paid at the door on my way out, and I had all my medications with me. And I thought, wow, someday we could have that here in this country. Well, I'm proud to say that what we're seeing today with the rollout of this package is the start of that kind of transformation. This is something that we can take to all individuals who have all walks of life, and believe you me, there is everyone who has need of it. It comes from people who are dealing with organ transplants and have to have medications every month, people who are on insulin, and access to telehealth when you're not near your doctor. All those things are so very important, and I'm very proud to be part of this package. I thank you for this opportunity, and now I will introduce Representative Cambenzi.
Well, I'm proud to be part of this package as well, and I really want to thank Speaker Wentworth for being proactive and forward-thinking. This has been a long time coming. As a type 1 diabetic myself for 34 years, I understand the struggle that many diabetics face when they go to pay and pick up their insulin every month. What started off the same type of insulin that I'm using now 20 years ago at $20 a vial has now skyrocketed to almost $400 a vial. When you don't have insurance and you don't have co-pays that you can afford, what are you left to do? And so the calls that have come into my office have been, I am making a choice. I'm choosing to not pay my rent this month. I'm choosing to go without groceries. I'm choosing to do things because I need my insulin more. But some people aren't that lucky. Some people are skipping doses. Some people are trying to manage their diabetes just with the food and water that they take every day, and this is not acceptable because the long-term effects of this type of game playing with a serious illness results in hundreds of thousands of millions of dollars every year in healthcare costs that could be avoided. So I'm proud to be part of this package. I'd like to thank my colleagues for stepping up and being a part of it as well. And now I'd like to turn it over to Speaker Wentworth.
Thank you. I'd also just like to say thank you one more time to Chair Cowley, Vice Chair Whitwer, for the work that you guys are going to do in the committee. It's going to be a phenomenal process that we'll go through with these bills. And I also want to thank the rest of the members for being here today.